This conference will now be recorded.
Hi guys, my name is LaDonna Cavanis and I'm an instructor here at Ultimate Medical Academy. Today we're going to be going over body planes and the musculoskeletal system. So let's get started. Body planes are hypothetical geometric planes used to divide the body into sections. They are commonly used in both human and zoological anatomy to describe the location or direction of bodily structures. Reference planes are the standard planes used in anatomical terminology and include the coronal or the frontal plane divides the body into dorsal and ventral, back and front, or posterior and anterior portions. A transverse plane, also known as an axial plane or cross section, divides the body into cranial and caudal, which is the head and tail portions. A sagittal plane divides the body into sinister and dexter, left and right portions. Body planes have several uses within the anatomy field, including in medical imaging, descriptions of body motions, and embryology. While these are the major reference bodies, planes of the bodies, other planes are commonly used in relationship to these three. A longitudinal plane is any plane perpendicular to the transverse plane, while the perisagittal planes are parallel to the sagittal plane. The coronal plane and the sagittal plane and the perisagittal planes are examples of longitudinal planes. And here's an image of the sagittal, coronal, and transverse planes. There are three basic planes in zoology: anatomy, sagittal, coronal, and transverse. A human in the anatomical position can be described using a coordinate system with the z-axis going from front to back, the a-axis going from left to right, and the y-axis going up and down. Medical imaging techniques such as sonography, CT scans, MRI scans, or PET scans are one of the primary applications of body planes. By imagining or imaging a patient in standard anatomical position, a radiologist can build a XYZ axis around the patient to apply body planes to the images. The planes can then be used to identify and locate the positions of the patient's internal organs. Individual organs can also be divided by planes to help identify smaller structures within that organ. Body planes are used to describe anatomical motion and the X, Y, and Z coordinate systems that the body moves through. An anatomical could model a limb's range of motion by measuring which planes the limb can move through and how far it is able to travel. Anatomical change during embryological development is also described and measured with body planes. For example, during human embryonic development, the coronal plane is horizontal but becomes vertical as the embryo develops into a fetus. In comparative embryology, body planes provide a basis for comparing the ways in which different types of organisms develop anatomically within the womb. Body cavities, or spaces of the body, contain internal organs or viscera. The two main cavities are called the ventral and dorsal cavities. The ventral is the larger cavity and is divided into parts: thoracic and abdominal pelvic cavities. By the diagram, a dome-shaped respiratory muscle. All right, let's talk a little bit about the thoracic cavity. The upper ventral thoracic or chest cavity contains the heart, lungs, trachea, esophagus, large blood vessels, and nerves. The thoracic cavity is bound laterally by the ribs covered by costal pleura, and the diaphragm caudally covers the diaphragmatic pleura. Abdominal and pelvic cavities, which is the lower part, can be further divided into two portions, abdominal portion and pelvic portion. The abdominal cavity contains most of the gastrointestinal tract, as well as the kidneys and adrenal glands. The abdominal cavity is bound cranially by the diaphragm, laterally by the body wall, and caudally by the pelvic cavity. The pelvic cavity contains most of the urogenital system as well as the rectum. The pelvic cavity is bounded cranially by the abdominal cavity, dorsally by the sacrum, and laterally by the pelvis. All right, dorsal cavity. The smaller of the two main cavities is called the dorsal cavity. As its name implies, it contains organs lying more posterior in the body. The dorsal cavity, again, can be divided into two portions. The upper portion, or the cranial cavity, houses the brain, and the lower portion, or vertebrae canal, houses the spinal cord. All right, let's talk a little bit about the skeletal system. These are related combining forms. So these are examples of combining forms related to the bones, the bone marrow, cartilage, joints, ligaments, synovial membrane, synovial fluid, and the bursa. Structures and functions of the skeletal system consist of bones, bone marrow, cartilage, joints, ligaments, synovial membranes and fluids, and bursa. And here's a breakdown of the medical terms for these different structures and functions of the skeletal system. Framework of the body provides support and protection to the internal organs, provide wide variety of body movement, storage and important minerals, red bone marrow located in the spongy bone. These are all functions of the and structures of the skeletal system. Formation of bone. Ossification begins after 3 months gestation and continues through adolescence. Growth bones continues through the action of osteoclast and osteoblast, repairing minor damage and fractures. Structures of the bone. Bone is the second hardest tissue in the body. And here's an example of the tissue of the bones. And we'll go into each of these tissues over the next couple slides. Okay, so let's start with the periosteum. Tough fibrous tissue forming outermost covering of the bone. And when you break that down, peri means surrounding, osteo bone, and un, it's a noun ending. Compact bone, dense, hard, strong forming bone. It protects the outer layer of the bone. Spongy bone, thus more susceptible to fractures. Medullary cavity, center of the long bones, storage site of red and yellow bone marrow. Endostenium lines the medullary cavity. Bone marrow, red bone marrow located within spongy bones. Tissue manufacturing red blood cells, hemoglobin, white blood cells, and thrombocytes. Partially replaced by yellow bone marrow during adolescence. Yellow bone marrow, fat storage in long bones, medullary cavities. Cartilage, smooth, rubbery, blue-white connective tissue acting as shock absorber, more flexible than bone. Articular cartilage covers surfaces of articulation joints, allows smooth joint movement. Meniscus covers fibrous cartilage in the joints. And here's an illustration of cartilage, and we'll go into these over the next couple slides. Anatomic landmarks of the bones. Diaphysis, which is the shaft of the long bone. Epiphysis, which is the wider ends of the long bones. Proximal epiphysis nearest midline. Distal epiphysis is farthest away from the midline. Okay, foramen opening in a bone allowing passage of blood vessels, nerves, and ligaments. Process projection allowing for the attachment of muscles or tendons. Joints articulate, union or two or more bones, classified according to structure or degree of movement. Fibrous joints. Inflexible layers of dense connective tissue holds bony bones tighter together, also allows as sutures do not allow for movement. Cartilage joints consist of bones connected by cartilage, allow slight movement of joints, and that's cartilaginous joints. Synovial joints, articulation of joints permitting variety of movement, described on the basis of the type of motion, ball and socket, hinge. Synovial joints. So here's some examples of synovial joints. The hip joint, the elbow joint, and the knee joint. And these joints, as you can see, if you start moving these particular joints around, they're really flexible. So these are called synovial joints. Components of synovial joints. So you have the synovial capsule, which is the outermost layer resembling a sleeve. You have the synovial membrane. It lines the capsule, secretes synovial fluid. Then you have synovial fluid, which lubricates, allowing for smooth movement of joints. Components of synovial joints. Ligaments, fibrous tissues connecting one bone to another. Bursa, fibrous sac acting as cushion, easing movement in areas subject to friction. An example would be of those synovial joints that we talked about earlier, the elbow and the knee. Skeletal. Axoskeletal protect major organs of nerves, respiratory or circulatory systems. Organized in 5 parts: bones of the skull, ossicles of middle ear, hyoid bone, rib bone, and vertebral column. Appendicular skeletal protects organs of digestive, excretion, and reproduction. Organization. Upper extremities consist of shoulders, arms, forearms, wrists, and hands. The lower extremities consist of the hips, thighs, legs, ankles, and feet. Bones of the skull. Cranium, 8 bones. The face, 14 bones. The middle ear consists of 16 bones. So again, that's cranium 8, face 14, and middle ear 16. And we'll start talking about the bones of the cranium. These are just some illustrations of the cranium. So bones of the cranium. So you have the frontal bone. It consists of anterior portion of the cranium, forms the forehead, and then you have the parietal bone, which are paired and form most of the roof and upper sides of the cranium. So here at this side, you have the occipital bone, the back part of the skull, and the base of the cranium. And then you have the temporal bone paired, form sides and base of the cranium, and house the canal known as the external auditory medius. So here you have the sphenoid bone, wedge-shaped bone at the base of the skull. It makes contact with all other cranial bones. Then you have the ethmoid bone, spongy bone located at the roof and sides of the nose, separates the nasal cavity from the brain and forms a portion of each orbit. Auditory ossicles. Auditory ossicles, three tiny bones located in each middle ear, the malleus, the incus, and the stapes. Two nasal bones form part of the bridge of the nose. Two zygomatic bones, they articulate with frontal bones, and two maxillary bones, which form most of the upper jaw. All right, bones of the face continue. Two palatine bones form anterior parts of the hard palate of the mouth and the floor of the nose. Two lateral bones make up part of the orbit and the inner angle, at the inner angle. And two inferior conchies, which form part of the interior part of the nose. Bones of the face, you have the vomer bone, which forms the base of the nasal septum, and then you have the mandibular or the mandible, only movable bone of the skull. All right, let's talk about the thoracic cavity, also known as the rib cage. It protects the heart and lungs. It consists of ribs, sternum, upper portion of the spinal column, extending from the neck to the diaphragm. All right, ribs consist of costals, and let's break that down. COST means ribs. AL is always pertaining to 12 pairs attached posterior to thoracic vertebrae. True ribs, first 7 pairs, attach anteriorly to the sternum. False ribs, next 3 pairs, attach anteriorly to cartilage that connects them to the sternum. Floating ribs, last 2 pairs, attach only posterior to the vertebrae, are not attached anteriorly. Let's take a look at the sternum. We'll go over these parts over the next couple slides. So the sternum consists of flat bone located in the middle of the chest, 3 parts. Um, the manubrium forms the upper portion of the sternum. The body forms the middle portion of the sternum, and the xiphoid process, made of cartilage, forms the lower portion of the sternum. Forearm pectoral girdle supports arms and legs. The clavicle supports the collarbone and it connects to the mandibular to the scapula to the shoulder bone. Okay, the acromion, extension of the scapula. It forms high points of the shoulders. Humerus, these are parts of the arm. Humerus, the upper arm, the radius, the smaller, shorter bone, and the forearm, and the ulnar, which are the larger, longer bones of the forearm, and the ossarium process, which is the large projection of the upper end of the ulnar. Wrist, hands, and fingers. All right, so 8 carpal bones form the wrist, 5 carpal bones form the palms of the hand, 14 phalanges, bones of the fingers. 4 fingers have 3 bones, thumb has 2 bones. All right, let's talk a little bit about the structure of the vertebrae. The body consists of anterior portion, solid to provide strength, the lumina posterior portion, the vertebral foramen. It's an opening in the middle vertebrae, allowing for passage of the spine. Okay, cervical vertebrae. It's a set of 7, so we're talking C1 through C7. It forms the neck. The thoracic vertebrae, it's a set of 12, T1 through T12, a pair of ribs attached to each. Lumbar vertebrae, it's a set of 5, so we're talking from L1 to L5. It's the largest and strongest vertebrae, and it bears most of the body weight. The sacrum forms the lower portion of the back. 5 separate bones are at birth fused together to form this one single bone. The coccyx, also known as the tailbone, it forms the end of the spine. It's made up of 4 small bones that are fused together. The pelvis. So we're going to talk a little bit about the pelvis. So let's go ahead and get started. So the pelvis protects the internal organs. It supports the lower extremity, the ilium. It forms back and side of the pubic bone of the sacroiliac articulation between the sacrum and the posterior part of the ilium. And if we break this medical term down, sacral or sacroiliac, SACR, which is your prefix, you have a combining form, and you have ilium, which is your suffix. When you pull that all together, it's sacroiliac or sacroilium. All right, we're continuing to talk about the pelvis. So the ischium, it forms the lower portion of the pubic bone. It bears weight on the body when sitting. Let's talk a little bit about sitting at on the pubis. It forms the anterior portion of the pubic bone, the pubic symphysis, cartilage joint uniting left and right pubic bones. All right, the acetabulum, it's the large circular cavity in each side of the pelvis. It articulates with the head of the femur to form the right hip, or to form the hip joint, I'm sorry. All right, the femur's largest bone in the body, knee is the patella cap, the popliteal is behind the knee, the cruciate ligaments allow movement of the knee. The lower legs, tibia, shin consists of the shin bone and the larger anterior weighted bearing bone of the lower leg. The fibula is the smaller of the 2 bones of the lower leg. All right, a little bit more about the lower leg. So lower legs consist of the tibia bone, um, the shin bone, the larger anterior weighted bearing bone of the lower leg, and the fibula, which is the smaller of the 2 bones of the lower leg. Let's talk a little bit about the ankle. Joints connecting lower leg and foot allows for movement, made up of 7 tarsal bones, malleus, rounded bony projection of the tibia and fibula on sides of each ankle. The talus articulates with the tibia and the fibula. The calcaneus consists of the heel bone and is the largest of the tarsal bones. Feet and toes. Let's talk a little bit about that. The metatarsals form 5 bones, form parts of the foot to which the toes are attached. The phalanges, the bones of the toes, the great toe has 2 phalanges, other toes have 3 phalanges. All right, medical specialties related to the skeletal system. So let's talk about the chiropractor. They specialize in manipulation, treatment disorders related to misalignment of the spine. The orthopedic surgeon specializes in diagnoses, treating diseases and disorders involving bones, joints, and muscles. Okay, osteopath. It combines traditional forms of medical treatment and spine manipulation. And let's break this term down. Osteo means bone and path means disease. Podiatrist specializes in diagnosing, treating disorders of the foot. POD means foot and iatrist specialist. Um, Rheumatologists, they specialize in diagnosing, treatment of arthritis and other disorders related to inflammation of the joints and the connective tissues. Ankylosing, it's loss or absence of mobility in a joint due to disease, injury, or surgical procedure. When we break that down, ANKYL, crooked, bent, or stiff, osis, abnormal condition or disease. Adhesive capsulitis, it's painful ankylosis of the shoulder. When you break it down, capsule, CAPSUL, means little box, and itis, again, refers to inflammation. All right, pathology of the skeletal system. So our arthrosclerosis is stiffness of the joints, and when we break that down, arthro refers to the joint, sclerosis refers to abnormal hardening. Baker's cyst, it's a fluid-filled sac behind the knee. Bursitis, inflammation of a bursa. All right, more on pathology of the skeletal system. Okay, so let's talk about chondromalacia. It's abnormal softening of the cartilage. Chondro refers to cartilage, and malacia refers to abnormal softening. Costochondritis, it's inflammation of the cartilage that connects a rib to the sternum. And you break that down, costo refers or means rib, chondro means cartilage, and again, itis refers to inflammation. Hallux valgus, abnormal enlargement of a joint at the base of the great toe. Okay, and let's talk about this one. Hemarthritis, it's blood within a joint. Heme refers to blood, ARTHR refers to joint, OSIS, abnormal condition or disease. Polymyalgia, right? Polymyalgia, rheumatic. It's inflammatory disorder of the muscle and joints. And you break that down, poly refers to many, my refers to muscle, and algia refers to pain. Sprain due to wrenching or tearing of a ligament. Synovitis, inflammation of the synovial membrane resulting in swelling and pain of the affected joint. And you break that down, SYNOV, synovial membrane. Luxation, total displacement of a bone from its joint. Sublation is partial displacement of a bone from its joint. Arthritis, it's an inflammatory condition of one or more joints, more than 100 types. ARTHR refers or means joint, and itis means inflammation. Most commonly associated with aging, osteoarthritis. It's most commonly associated with aging. And you break it down, osteo means bone. It's characterized by wearing away of articular cartilage within the joints and hypertrophy of the bone and formation of the osteophytes, also known as degenerative joint disease or wear and tear arthritis. Feet and toes. Okay. Spondylitis is a degenerative disorder causing loss or abnormal spinal structure and function. When we break it down, SPONDYL, of the vertebrae, And then OIS is an abnormal condition or disease. Gout. Um, Type of gout arthritis characterized by deposits of uric acid crystals in the joints. Joint exhibits warmness, redness, and extreme sensitivity. Rheumatoid arthritis. It's a chronic autoimmune disease attacking joints and other organs. Joints become inflamed and thicken. Joints are increasingly swollen, painful, and immobile. Ankylosing spondylitis. It's a form of rheumatoid arthritis. It causes inflammation of the joints between the vertebrae. All right. I would like to thank you guys for joining me on my presentation.